And it's our weekly, let's check in with Imperial County and see what's happening. And today we are visiting with the Imperial County Public Health Department Director, Janette Angulo, and we're going to get some updated information on the COVID-19 pandemic here in the Imperial Valley and, some changes that have been happening. Good morning, Janette.
Good morning, Carroll.
Well, it's just another beautiful day in the Imperial Valley, and we look at the dashboard that the Health Department publishes every day, and we share that information, and, we want to ask, okay, what does the numbers show right now? Where are we heading? Are we going in the right direction? Give me some good news.
Where are we? Let's start with the number of tests. We've done a little over 69,000 tests, and of those, close to 12,000 individuals have tested positive. Those are just Imperial County residents. And of our positive cases, good news is that 95% have already recovered. We do have a little under 300 cases that are in the process of recovering, so either at home or at the hospital. And unfortunately, Carroll, as of October 1st, Imperial County has reported 323 deaths. Now, when it comes to age groups, we still see that, the age groups that are mostly affected are those between the 20 to 29 age range, as well as 30 to 39. And then it's followed by those that are 50 to 59, and then you'll also have 40 to 49 who have, the higher number of cases. So that's where we stand with some of our information.
Okay. Now, testing. Let's talk testing. We have encouraged people, get tested. It's free. It only takes a couple of minutes. It doesn't hurt. And okay, you have no symptoms, good chance you're going to test negative. We need negative testing, don't we?
Well, let's talk a little bit about testing positivity percent. And for those of you that are following, the metrics, the case rate and testing positivity percent, well, we are still not quite there yet with our red tier metrics. Imperial County finds itself in the purple tier, which is tier 1. And this last week, if you're following the numbers, we had an adjusted case rate of 9.2 and a testing positivity percent of 8.7%, and that's the state numbers. So we are 0.7% away from falling into the red tier testing positivity percent and about 2.2 from the case rate. Now, testing in Imperial County, we're not doing as much testing, Carroll. Actually, our average is way below the state's average, and I looked at the numbers this morning, and we're doing about 130 tests or so per day on average, and that's really low. So we do have providers out in the community that are testing, and we also have the community site, which, let me tell you, Kxo site is closing today. It's underutilized. It was underutilized, so therefore the resource needs to go to a county where there's a greater need. Site in Brawley is still up and running and will be up and running until November 30th. So that resource is still available, and it's at the Brawley Senior Center. If you haven't made an appointment, make an appointment now, or you can walk in.
Okay, they're doing walk-ins now.
Yes.
Okay,
yeah.
If you've been tested once, say 3 months ago, can you get tested again?
Yes, you can.
Okay. And you pointed out people in Imperial County are not getting tested, and we need to have, looking at it from an economic sense, we need to have people tested that show negative numbers. And that will move the metrics in a more positive way. It sounds confusing. We need negative numbers to move in a positive direction. And the way that's going to happen is we get more people testing.
And for the public health department, the more people get tested, it helps with surveillance activities. It gives a better picture of where we truly stand. So just as an example, several weeks ago when there was quite a bit of testing, you noticed that our testing positivity percents were actually lower, and so was our case rate. It gave us a better sense and a better picture of where we really stood. So yes, the more testing that happens in our community, yes, the better surveillance we have.
And again, from an economic standpoint, if we are to move to the next level in the Skittles schedule, we have to have more negative tests.
That is correct.
You pointed out very clearly when we had more people testing, there were more negatives. So that's, that's a positive to move in that direction.
Yes, and the test at the Brawley Senior site through the Optum Serve site is at no cost, and it's Monday through Friday, and they serve individuals from 7 a.m. to 7 p.m. So a lot of opportunity to get tested there.
Okay, and they are accepting walk-ins, you said?
Yes, they are.
Okay, get tested. It's helping. Okay, now, we just got a news release that you're accepting applications for school waivers. What's this mean?
So for counties that are in the purple tier, the state actually allows public and private schools to apply for a waiver if the local health officer makes that available. We early on, we're taking a look at our numbers and decided not to make waivers available until our situation got a little bit more stable. And even though we're in the purple tier, our numbers are definitely better than several months ago. So therefore, in conversations with schools and, of course, the public health department, we decided that, it was time to make that waiver available. And this is only applicable for grades TK through 6, so transitional kinders through 6th grade. And the waivers will be accepted starting this coming Monday. Now, something important to note is that when applying for a waiver, school officials, they must submit evidence of, consultation with labor and parent organizations. And if there's no labor organization, then consultation with school staff. Now, schools also need to have reopening plans, and within those plans, schools must include details about cleaning and disinfecting, health screenings, health hygiene practices, physical distancing, use of face covering, cohorting, training, education, among other things. So once that application is together, they submit it to the local health officer. He reviews, and he reviews the plan, the epi data, how are we doing at that point in time in Imperial County. Then he makes a determination whether to grant or deny the waiver, and this also happens in consultation with the state. So it's a whole process that, schools need to go through.
Okay. And have you received any applications yet?
Not yet. We'll start receiving them on Monday, October 5th.
Okay. And, of course, that's an area that I know you're going to be an overabundance of caution to make sure that things go well.
Of course. And we're working very, very closely with the schools, to make sure that they have the guidance documents, to make sure that they're actually ready. And it's been a great partnership with the schools, let me just tell you.
Okay. Have we missed anything?
Well, do you want to talk a little bit about this new announcement that was done earlier in the week about health equity?
Well, let's talk about it.
Well, you may recall that back on August 28th, when the state did this rollover into the new blueprint, it included 3 metrics. It included the case rate, testing positivity, and health equity. The case rate and testing positivity metrics, those were defined, but not the health equity metric. This was back in August. Now, this week, the state finally announced that the health equity was ready, and it would be released, in the next few days. So Tuesday, this coming Tuesday, we expect to hear more. But what does this really mean for Imperial County? Well, Imperial County is not exempt from that metric. The health equity metric is tied to testing positivity and looks at disadvantaged communities to ensure that they don't lag behind in the overall testing positivity rate. So, for example, if we have the south end of the city that has a testing positivity percent at 2%, but then we have the north end of the city that's testing at 15%, we need to look into that. You know, why is one side of the city testing at 2% and the other one is testing at 15%? And then just implement interventions to make sure that all areas are getting the services that they need and that they have access to testing. So counties will need to address, like I said, testing disparities if there are any. The data should be made public this coming week. And in order to advance to the next less restrictive tier, a county will need to meet the health equity metric or demonstrate that we have interventions. So, for example, testing, investigation, contact tracing, outreach, etc. We have to have that in place to eliminate such disparities. And something to note is that the health equity metric will not be used to move a county to a more restrictive tier. So just a little bit of what's coming next week, and we'll do a little bit more outreach and information in the coming days about, you know, the health equity metric.
Okay, and direction coming from Sacramento, and we've had 3 major shifts in the direction, and as you're saying, there's liable to be more in the coming week, right?
Yes, but this health equity metric was there all along. It was just not defined. That's what happened.
Okay. Well, yeah, I guess in some respects we should say this is a learning process as we move forward.
It is, and it's actually something really good because, you know, we take a look at our county and we identify gaps and we identify disparities and we take care of those. So I'm actually excited about this.
Okay. So let me just kind of summarize. Testing continues at the Brawley Senior Center, right?
Yes.
And it's 7 a.m. till 7 p.m. Monday through Friday now, right?
Correct.
It's free. It's painless. They are now accepting walk-ins.
You got it.
Get tested. And even if you have been tested, 2-3 months earlier, get tested again just to be on the safe side because, hey, you could test negative yesterday and positive today, right?
Got it, yes.
Okay, and hopefully the numbers on the dashboard continue to move in the right direction and we can start reopening parts of the economy.
That is correct. We really want to move in a positive direction, always keeping the health and safety of this community as first priority.
Okay, and a reminder, facial coverings are required. Social distancing is still mandated, so make sure you practice. I find it interesting, and it may have to do with, the generational thing. You pointed out the biggest numbers of positive testing now are coming in the 20 to 29 and the 30 to 39 age groups. 20 to 29, invincible, right?
I'm not going to say anything. But no, COVID is affecting everyone.
Look at the White House.
From the younger ones to the older ones. And you know what, Carroll, as more and more reopenings are happening, because some sectors of our community have happened, if you are seeking those services, make sure you stay safe. Like you said, the face covering is required. It really helps. Hand washing, the physical distancing, and staying home if you're sick. Do it for yourself and do it for those that are around you. So take really good care of yourself. Okay.
Janette, you've done a great job explaining things, and I hope that answers questions that we have been getting. So what do the numbers really mean? Well, you explained it pretty well there. So anyway, it's rock and roll Imperial Valley with COVID-19, and we're going to stay safe. You have a great weekend.
You too, Carol. Thank you so much.
And it's Smile Day. It's hard to see the smile behind the mask, but you can see it in the eyes, okay?
You got it.
Okay.
Bye.
Janette, thank you, and have a great weekend.
You too. Bye-bye.
And that's Janette Angulo, the director of the Imperial County Public Health Department.